So we're here in Frankfurt in Germany at the EBMT meeting, and there's been some really very interesting developments in the management of diffuse large B-cell lymphoma in the relapse setting, and particularly in regard to how we integrate stem cell transplant strategies into the treatment of patients with relapsed disease. The current standard of care at the moment for patients with relapsed disease is to proceed through salvage chemotherapy and an autologous stem cell transplant. Now, for many years it's been clear that a significant number of patients don't do well with that treatment approach, and so investigators have for many years been looking at alternative strategies to see whether we can improve the outcomes. And one of the strategies that has been used in that setting is to use an allogeneic stem cell transplant, and there is some data to demonstrate that it may be an effective treatment option for a select group of patients in that setting. However, now in the era of CAR T cells, where we have a very new, very exciting and an apparently effective treatment strategy that you can also use in that setting, we now have for these patients a choice of, well, do we do an autologous transplant, do we do an allogeneic transplant, or do we use CAR T cells as a salvage therapy for these patients. Currently, the data is still quite immature regarding CAR T cells, so we need some longer term follow-up to see really how effective they are. But the reality is that the CAR T cells appear to be associated with less toxicity when measured by actual treatment-related deaths when compared to an allogeneic transplant. So in some respects, CAR T cells can look a little bit more attractive than an allogeneic transplant. But still, we need more data about the CAR T cells. We need to work to improve the treatment-related mortality that we see in allogeneic transplants. And there's now clearly competing therapies in that particular setting. And then the next major place where we've traditionally used allogeneic transplants in diffuse large B-cell lymphoma has been for those patients that have had an autologous transplant, they've relapsed, and then you're struggling to work out how best to treat them. And for some patients, if you can get their disease into a good response again, proceeding to an allogeneic transplant has been a treatment option that many people have used. Then arrives CAR T cells, and we now have CAR T cells also as an agent that can be used for patients that have relapsed after an autologous transplant. So now we have allogeneic transplants competing with CAR T cell therapy in the post-autograft failure setting. So it's good for the patients because we have more therapies, there's different types of therapies we can use, but it means that some of the traditional ways that we've been treating patients are going to be used less frequently. And it may be that if the data regarding CAR T cells proves to hold up with longer term follow-up, it may be that we see allogeneic transplantation being pushed out and actually being reserved for patients that have failed CAR T cell therapy. So it's a very dynamic time with all of these different therapies that are coming on board.